But really, how does hormonal contraception work? Hormonal contraceptives contain progestin, a synthetic form of the hormone progesterone, with or without estrogen. These can prevent pregnancy via a number of mechanisms, such as preventing ovulation or the release of an egg, making the cervical mucus thicker so that it's more difficult for the sperm to enter the uterus, and making the uterine lining thinner to prevent implantation of a fertilized egg. In addition, hormonal contraceptives also have a number of other benefits, such as reducing the risk of ovarian, uterine, and colon cancers, reducing blood flow during your monthly period, and reducing menstrual cramps that a lot of women experience. They're available in a number of different forms, such as oral pills. These are either progestin only or a combination of progestin and estrogen, and can be taken cyclically for 3 weeks followed by a week off, or taken continuously. Progestin injection. This needs to be taken every 12 weeks. Skin patch. This contains a combination of progestin and estrogen and is worn for 3 weeks followed by a patch-free week. Vaginal ring. This is a small flexible ring that contains a combination of progestin and estrogen and is worn for 3 weeks followed by a week without the ring. The vaginal ring can also be removed for a short period of time during sexual intercourse. Progestin IUD or intrauterine device. This can last for up to 5 years but can also be taken out sooner. Both the insertion and removal of an IUD needs to be performed by a medical professional. And progestin implant. This is a thin stick-like implant that's inserted under the skin and can last for up to 3 years but can be taken out sooner. Again, the insertion and removal of an implant needs to be performed by a medical professional. Hormonal contraception is generally safe, but it's not recommended in women with certain conditions such as clotting disorders, a personal history of breast cancer or suspected breast cancer, a history of stroke or coronary artery disease, a history or current diabetes with circulatory disorders, or some other conditions. So if you are considering hormonal contraception, it's always a good idea to talk to your doctor first to make sure this is the right option for you. While hormonal contraceptives prevent 99% of pregnancies when used correctly, it's important to note that they do not protect you from sexually transmitted diseases. So if STDs are a concern, make sure you use condoms in addition to another method of birth control.